It's all about the economy, and certainly economists, as well as those who watch this very carefully, they're very divided about the latest inflation report card that I've told you about. Consumer Price Index, of course, the news was the headline dropping to 3% year to year in June, and that's down from a 4% headline rate in May. Core inflation, excluding volatile food and energy prices, which is, important, only grew by 0.2% month to month, right? And so when you look at all of this, there is a silver lining, and anything positive, anything that looks like growth is a good thing. Unfortunately, that CPI report is not expected to change the outcome at the Federal Reserve's meeting upcoming July 25th and 26th. And there's a lot of consensus on that there's still, everybody's bracing for the fact that the Fed is, yes, once again, considering hiking rates. And so you think of the impact on our economy. And also, I'll point out, they're looking at month to month. But if you go back a few years, then that explains when we look at the fact that you're paying, 17, 20+% more for basic foods than you were 2 or 3 years ago, and in some cases even more for that. And so that's why we can say, well, wait a minute, it's, they're saying, oh, it's only 3% or 4%. No, that's month to month, year to year numbers. But look back pre-pandemic, for example, and that gives you the sense of what's really going on. So all of this matters. It matters to each and every one of us. We're feeling it for sure. And look at your energy bill. Look at your water bill. Even in Philadelphia, I haven't even talked about this, the fact that they're redoing the meters, and a lot of people have questions about the rising costs of basic utilities. And that really gives us a perspective for our next guest, and that's Eric Calciano, who's the lead benefits advisor at New City Insurance. And he's talking about Medicaid. And we knew this was coming to an end when in other words, the pandemic type emergencies that allowed for getting people help, people who are in vulnerable communities, poor people, children, etc., got them a little extra help, and they could apply for and get Medicaid. And this could really affect as many as 17 million Americans could lose coverage. And we're talking about, kids. We're talking about people who are very vulnerable. And so, and in those communities that received a little bit extra help during the pandemic. So welcome in, Eric. Thanks so much for being here to break this down for us.
Yeah, absolutely. Thank you for having me. Absolutely.
So, tell me about it, because a lot of people might say, well, we've all got to move on post-pandemic, and taxpayers can't just keep on paying all of these different individuals to be bankrolled by the federal government, and ultimately it's not the federal government that pays, it's we the people, we the taxpayers. So take me through it and explain the concern, the issue. Take it away.
Okay, yeah, sounds good. So basically what happened is that during the public health emergency, Congress banned states from removing individuals from Medicaid coverage. So they said individuals no longer have to reconfirm their income to be able to stay on Medicaid. And now Medicaid, for those of everybody who's not entirely sure, as you mentioned, it's for the lower income individuals, and it is the state-run healthcare. But while it's state-run, it's heavily financed by the federal government. So when the federal government came in and said, we're banning the removal of anybody from these Medicaid plans, they basically got to call the shots there. And then over the years of the public health emergency, this led to a historic surge in enrollments in Medicaid. And so there are currently about 93 million people enrolled in Medicaid, and that's compared to 84 million in 2021. So we did see a big spike. It was a historic high. And these protections from Medicaid expired in April after Congress passed a spending legislation in December that gave states the green light to start reviewing people's eligibility for the first time in years. And each state is taking it on at a different time frame, so that time frame that we're looking at, it varies state to state. But so far, about 1.5 million people have been disenrolled. We're seeing the front runner there is Florida has had the highest amount of disenrollments at over 250,000. And it's estimated that 17 million people could lose their Medicaid coverage in this process. But the problems go a little bit deeper than that. So now that the protections have expired, many people just don't realize that they have to verify their eligibility and are being unenrolled. And so this is the case even for individuals that are still eligible for Medicaid coverage. They just don't realize that they're being asked to re-enroll in coverage. So a majority of the people that have been kicked off Medicaid in 11 of the states that have started removing individuals lost their coverage not because they were no longer eligible, but because they did not complete their paperwork or because the authorities were unable to contact them. And it's estimated that 6.8 million people are expected to lose their coverage even though they remain eligible. So of that 17 million, almost 7 million of them is likely just going to be due to the difficulty of re-enrolling or making sure that they, even just knowing that they must re-enroll.
And for our audience, Eric Calciano, you're a managing partner of New City Insurance. I've seen you on all the different networks, including Fox and CBS, NBC, ABC. A lot of people want to talk to you and tap into your expertise in this area because you've been doing this as an employee benefits industry expert for about a decade. And so what do you say as far as, first of all, to break it down, there was a lot of fraud going on with Medicaid. A lot of people are concerned about that. And then parsing that and saying, well, how do we, investigate the fraudsters and separate them out from those, like you're saying, that are actually needing and deserving and qualify, but they can't even, make sure that they fill out the proper, I guess it's a bureaucracy, filling out the proper paperwork, et cetera.
Mm-hmm. Yeah, when it comes down to it, a lot of the individuals that are on the plan, even those that no longer qualify, because those special rules were put in place, they weren't necessarily creating. It wasn't necessarily a fraud situation as much as it was saying, hey, we're giving you a pass during this time to let you stay on Medicaid while we're going through this tough time. Mm-hmm. And so let's give everybody a break. And so even if your income allowed you to price out of qualifying for Medicaid, your income went up. Well, we realize that these are volatile times, and even if your income goes up soon, it might drop back down. And let's give everybody the ability to just have some stability when it comes to their health care. But what people should do now is make sure that they go through that re-enrollment process. Mm-hmm. And so that can mean a couple of things. The more passive approach is to be looking out in the mail. The different states, it varies state by state, but will reach out by mail. They'll also, if they have your phone, they'll reach out by phone call, text message, email if they have your email addresses. So many of the states were indicating that they reach out around 13 different times when they're looking to reach these individuals. But people's addresses change, people's phone numbers change, and it, there's a million things that come in the mail. So it's hard to always catch what's coming through. So the other way is to look at it proactively. So everyone can reach out to that is enrolled in Medicaid can reach out to their local county social services office and inquire and say, I'd like to make sure that I verify my eligibility and go through and proactively start that process. Yeah. That way you can be sure that if you're in that situation, that you and your family remain on the health plan. Mm-hmm. And then we mentioned, so of those that no longer qualify, because it's assumed that about 11 million of those 17 million are no longer going to qualify because their income has increased to a level that they are no longer eligible. Well, when you get removed from a health plan, and this is essentially with any qualified health plan, Medicaid included, it creates a qualifying event, which allows you to join another health plan in the 60 days, typically 60 days of when you lose your coverage. And so that opens up the ability to enroll on the individual marketplace or onto an employer-sponsored health plan if you have the ability to enroll through an employer or your spouse's employer, or if you're under 26, your parents' employer's plan. For those that don't have an employer plan available to them, the individual marketplace is the place where most individuals will go. And really many individuals, if your income is just above be qualifying for Medicaid, then you likely qualify for a really strong subsidy through the healthcare exchange. And so you can still typically qualify for some really inexpensive health insurance that way, where you're actually still getting some government subsidy. It won't cover 100% of the cost of the premium, but in certain cases, it'll cover up to 99%, and it's on a sliding scale based on your income. And so if it does turn out that at the end of the verification process that you no longer qualify for Medicaid, you get removed from Medicaid, that creates a qualifying event. You can go to the healthcare exchange, go to healthcare.gov, and be able to see if you qualify for subsidized care on that exchange, and that will work for many of the individuals that lose their coverage.
And so it looks like on a national level, we have a time where about 92% of Americans have insurance. The issue now is being underinsured. I know one of the areas that you speak out a lot about and that you know about are these so-called custom health plans. Working with employers. I just want to tap into this really quick before we go. What is that all about, and why is that something that more and more employers are looking to?
Yeah. So, when it comes to where the enrollments lie and the proportion of enrollments on different types of plans throughout the country, we're seeing just shy of 20% are on Medicare, just shy of 20% are on Medicaid, and about 54% are on employer-sponsored health plans. And so when we look at making changes in how healthcare operates in this country and how affordable it is, one of the biggest places where we can make a difference is in employer-sponsored health plans. We have a majority of Americans are covered through those employer-sponsored plans. When it comes to those plans, custom health plans where the employers are able to say, we're going to decide the vendors that work inside of our plans, allows for a more efficient running of a health plan. And ultimately, when employers are able to reduce their health insurance costs, they're able to pass that along to their employees in terms of decrease out-of-pocket costs when they go see the doctor and decrease premiums. And so when we see health insurance plans run more efficiently, we see them remove some of the profit-taking ability by the insurance companies, and then that money gets to be spread back to the business as well as their employees.
Nice. Well, Eric Calciano, thank you so much for joining us and giving us some of your insights and expertise, sharing that with us. Eric, thanks a million.